Today we have Evelyn Palmer here with us from the Lake of the Woods District Hospital. She is one of the sexual assault nurses, and she's going to do a presentation for everyone today.
Thank you, Joanne. We're here at Women's Place today on their soup day, which is an awesome day to come on Tuesdays. I'm just going to let you know a little about what goes on at the hospital if you come in and you've been sexually assaulted. So hopefully this never happens to you or anybody you know, but unfortunately 1 in 4 women do get sexually assaulted at some point. There's many avenues you can go right away once you're sexually assaulted. As long as you're safe, you can phone a friend or the police or KSAC, which is Kenora Sexual Assault Center, and they will assist you in getting to the hospital, or just phone a cab and say, I need to get to the hospital. The cabs are very good and they'll get you to the hospital. You come into the hospital, you come up to the first triage window, which is the emergency, and you just tell the girls, I've been assaulted, I need to see a doctor. They'll take you through to see the triage nurse, who will take your blood pressure and your vital signs and ask you if there's anything you need to see a doctor for. Do you have any open wounds? Do you have a broken bone? Is there any cuts? And then they'll get you fixed up that way. They'll also ask you if you would like to see the sexual assault nurse, which is, there's quite a few of us. It could take up to 15-20 minutes for one of us to come in, depending on the time of day. If you have to void in those when you first get there, that first pee is super important for our kits. If you choose to do a kit and just let the nurses know you need to pee, just collect that. If we don't need it, we can throw it out afterwards. We don't like to keep pee if we don't need it. So the nurses at triage should be asking you as well if you want to have a KSAC nurse come in, or a KSAC worker come in. And that's just someone to come and sit with you and help you through this whole process, because it is a bit of a process if you decide to do a kit. If you don't decide to do a kit, a sexual assault nurse can come in as well and help you find a safe place to go that night, or a safe place to get you to relatives. They'll help you get there. The KSAC workers will also help you get there. They're wonderful. They also have a drop-in downtown. I'm afraid I don't know the address. It's on Matheson Street. It's behind the Nietzsche Center, behind the cinema. I'm not sure the address, but it is there. And you can go there. They have a drop-in and you can talk to them at any time, even if you don't want to come to the hospital. So if you've come to the hospital and now you've said you want to see a sexual assault nurse, one of two things are going to happen. Now, unfortunately, if you have been drinking, we cannot get consent. So until you can't give legal consent when you've been drinking. So even if it's very fine line where we can get it there. If you come in and you've decided to go ahead with a kit, we take you over to the sexual assault exam room. Now that is, like I told a couple of people before, it's a special room that we keep closed all the time. It's locked because we do DNA samples in there. If you decide to go ahead with a kit, this is the kit that we have. This one doesn't have the plastic on the outside, but they come with plastic on the outside. Once we've opened the kit, the nurse cannot leave that kit alone. The nurse has to stay with that kit till we hand it off to the police or freeze it. At any time, if we're doing a kit and you feel uncomfortable, all you have to say, I don't want to do this anymore. We stop right away. You're the boss. You are in control. So like I said, the first P is very, very important. So we need to have that. That will, if anybody watches CSI or NCIS, all the information is on your body, all the data, all the DNA, we're going to collect it. And if you want to charge this person, that's going to be like the nail in the coffin at court, because you can't disprove DNA. It's pretty good. So you come in and we open up this kit, which I always have upside down. It has a special number on it. It's a sexual assault evidence kit. And of course they start with room 10. So we don't necessarily do the kit in order, but one of the most important things is that we get your underwear, because women, after you've had sex or even just normally, you get some fluid on your panties at some point. So those panties that you wore right afterwards, that's going to have some DNA in it, and we collect those. Sorry, if we collect them, you don't want them back, and you wouldn't get them back. We can freeze kits up to 6 weeks, and then we'll destroy any evidence if you haven't turned it over to the police. Then we'll do some swabs of your oral and some skin swabs, like if you feel that he has touched you any place, we can do a little swab. We can wet the swab, and you can rub that area, and then we put it in a special box. The Vag Swabs are just like when you go for your yearly, I think it's every 2 years now, your gynecologic exam. We take swabs from inside. We also check for any damage inside there or in the outer layer. Those get put in special things, and they also get put away. We also take a blood sample, but any of this part of this that you don't want to do, you don't have to do. Well, that's the urine bag. So, and then if you think you've scratched him at any point, we'll take scrapings from underneath your fingernails. We also, if there's been any damage, like if you've got bruises coming up, or you think he's punched you and you don't see anything, we do have a blue light and we can see bruises that are coming. And you also can come back a couple days later if you notice bruises. And we can take photos right there and then. We have the special measuring rulers. We take it in JPEG, which the police want, and then we hand that, once we've filed it properly, over to the police as well, if you want it to. So there's a couple of forms that you would have to sign. There's one saying that you give us permission to do the kit. There's a form saying that you give us permission to sign it over to the police, if you so wish. If you don't want to sign this, if you finish this kit, but you don't think you don't know what you want to do yet, we can freeze this kit. And like I said, we can freeze it up to 6 weeks. After 6 weeks, we discard it. So within that 6 weeks, if you decide you want to charge whoever did this, you just give us a phone call. You've signed everything. We just hand it over to the police. And they come in and take it from us. Sorry. So a safe place to go afterwards. If you have friends or family that you think are safe, that this person won't get at you at, that's a good place to go because you have supports there. Sakate House, I'm sorry if I've butchered that name, I'm very bad with that one. If they have room, we can get you in there. There's also an emergency bed at the detox. That may not be the nicest place to go, but it's certainly going to be a safe place. They have locked doors. There's lots of follow-up for you. There's a social work form that we fill out, that if you want us to fill out, and they will contact you and talk to you and see how things are going. One of my jobs is follow-up nurse, so anybody who's come in and been sexually assaulted and they see a nurse, I will phone them in a couple of days and say, how are you doing? Is there anything you need? And I will try and facilitate whatever you need. Now, I can't get you a trip to Blue Hawaii or Greece, but I can try and facilitate things that you need, like if you need to talk to social work, or if you need to get in to see the sexual assault center. They're very good there. We'll also probably give you a pamphlet on caring for yourself, and that's just, after you've been sexually assaulted, you feel guilty and you feel useless and you feel worn out, but that's normal. That's a normal feeling because you've been hurt. You're emotionally and physically hurt, but none of it was your fault. And that's the biggest thing that people think it's their fault. It's never your fault. You didn't ask for it, you didn't want it, and it's just not right. So we have done quite a few kits at our hospital. We have turned over, I'd say 99% of them. And usually with the kits, they have a conviction rate, a very good conviction rate. So the sooner after you've been assaulted, the better. We can still take some of the kit up to 7 days afterwards, but like I said, everything's on your body, the DNA and everything. So after that amount of time, it kind of degrades a little bit. So the sooner you get in, the better. And if you have a friend or family member who's been assaulted and they're worried about it, we are open to having more than one person. If you want somebody in the room with you when you're being examined, it's a very personal exam. So if you want someone in there to hold your hand, that's quite all right. We don't mind, as long as they just don't touch the kit. That's all good. I've had some of the women help me fold cardboard boxes and stuff, so that's helpful. And I've brought a few pamphlets and some pens and these keychains with lights. And I'm not sure what else I can tell you. If anybody has any questions, I'm free for any questions. I forgot, once the triage nurse knows that you've been sexually assaulted, we try and get you into a private room, one of the rooms, so you're not sitting in the waiting room. If the emergency is full, which in the summertime, it's always full, we try and get you, there's a very far waiting room. There's the 2 waiting rooms when you first come in, but then there's a far waiting room just outside the sexual assault room. We'll try and get you there. And you might want to have a KSAC worker there with you to just sit with you. And usually the nurses are there fairly quickly. So unless you have any questions, I don't really have anything more to say at this point.
I have a question.
Sure.
After a kit has been completed, because I know there's always a risk of pregnancy or STDs, and
Yeah.
so is there like
When we're doing the kit, we take the urine sample and we get it in an orange top container. Now with that, we'll do a pregnancy test to see if you are pregnant, because if you are pregnant, we can't give you the Plan B. It wouldn't show pregnancy if you got pregnant through that assault right that day. Then in the kit, there's the container with some white powder in the bottom. That's what we put the urine in for the kit. Now, after the kit's done, we'll go through some medications, some STD preventative drugs, and the Plan B, which will prevent you from getting pregnant. And sometimes a Gravel or a Tylenol, depending on how you're feeling. We'll ask you if you have any allergies to any medications before we give out any medications, but we have the capacity, and they're right there in the room, so we can, we don't prescribe it. It's just our policy to be able to give them out. We have a medical directive to give it out. There's the Plan B, there's drugs for a couple of STDs, and if you want the HIV drug, it's very hard on your system, but if you are concerned that this person might have had HIV, we'll give that out to you, and then you have to come back in almost every week to get blood work every 2 weeks and get a new set of pills and see how you're doing, because it will make you feel pretty yucky. But if you think the fellow might have had HIV, it's the way to go. Does that answer your question?
Yeah.
Okay.
Yeah.
Any other questions?
The other question is like, is there interpreters, like in case of if there's a language barrier?
If there's a language barrier, we will hopefully get an interpreter down ASAP, and we'll ask for a female one, because you certainly don't want a male interpreter. That would be a good case for a family member to come in, a female family member, and even if they want to stand behind the curtain, if you didn't want them in the room with you, they could just kind of stand behind the curtain and interpret. So far we haven't had, no, pardon me, we did have to use a family member once. Yeah, I do remember that. So that's a good question though. Any other questions, ladies?
I have a question. If the person was assaulted and they wanted to have the rape kit done, or they wanted to have all that done, let's say for instance it was someone they knew, or they didn't want to charge that person right at that time, they weren't sure, but you still want to talk them into going and having that done,
Mm-hmm.
do the police have to be involved right away?
The police don't have to be involved right away. No, the police don't, unless you phone the police don't know about it until we phone them and say, come pick up a kit.
I see.
So you could do the kit.
Poke somebody in the going when
Yeah.
you're having that done.
We could freeze this, like I said, up to 6 weeks. And at the 6-week point, we do discard them because the freezer's only so big. But the most important is the underwear that you wore at the time and the first pee.
So
So
you can just get it all done.
we can get it all done if she wants to have it done. And at any time, if you feel you're being invaded during this kit, you just say, stop, I can't do this anymore. Not a problem.
That's good.
So, yeah. Okay, so if we're doing the kit, this is what's in the kit. This is a drop cloth, which will, in the sexual assault exam room, there's a chair that you can move to sit in it the most comfortable way you want. There's a bathroom with a shower, and in the bathroom we'll put down the drop sheet. And in the drop sheet we'll ask you to get undressed, leave your underwear on the top drop sheet, probably not your outside clothes, but if do you think there might be something on it and you don't want them back, because you won't get them back unfortunately, leave them on the drop sheet and we will put them in there and put them in the kit. Number 2. So this is step 2, 4, 6, 8, and 9. So this is oral skin, external, the outside of your vagina, and the internal part of your vagina, which we do with a speculum, just like at the doctor's office. And also there's rectal swabs, because unfortunately sometimes the people who rape you obviously aren't very nice people, but they can be very rough and do bad things. The DNA sample, this is a DNA reference sample, which I'm dropping pieces of. So this is, so we have your DNA, so we can discern it from anybody else's DNA. So this swab, just looks like a lollipop, and you rub it on the inside of your cheeks. We will then take it and we'll put it on this card and rub it pretty good on both sides, and then it gets sealed up, and then we put this into the kit as well. So that will have your DNA on it. It also gets put into this bag, sealed up, nobody can tamper with it. So that's 10. For the urine, like I said, we're going to get you to pee in the orange top lids. That's so we can do the pregnancy test and send it away for any other testing. And then we pour some urine in this bottle so that we can send it away, because it needs to have the preservative in it. We also call down the lab, and the lab, we make sure it's a female lab person, and they draw some blood, and this too has a preservative in it, so we can send it away. And once we've done all that, we package it all up in this box. Everything is sealed with different sealants. We have to put the time we've done each swab. We then seal the whole box back together so it's totally sealed. And then if you wish to have this sent to the police right away, then we'll phone the police and they will come and take the kit. We need your signature so that you're saying, yes, I want the police to take this kit. And we want, now the police might want to do an interview with you at some point, because we won't have that much of an information. We're just collecting all the evidence. We're not collecting the verbal evidence of what happened. You might be telling someone, we'll write down what you tell us, but the police will make a complete statement. And I believe that's everything in the kit. And we have some stuff here for you to see. We also have Treaty 3 Police has just started with Support Our Saviors. Support Our Survivors. It's the SOS program, and that's Paradise and Karen. I have some cards here. It's a fairly new program, so I really don't know too much about it. They would be the ones to call, but they are both really amazing people themselves. And I believe that is it.
Thank you very much for coming out here today and visiting with all of us.